Our immune system is pretty much the ultimate bodyguard, right? It's this incredibly sophisticated army designed to protect us from all sorts of invaders. But what happens when that army gets confused? What if it can't tell friend from foe and turns its powerful weapons on the very cells it's supposed to defend? Well, today we're investigating a classic case of immune system friendly fire. Let's dive in.
I mean, just think about that for a second. Imagine your own personal defenders, the antibodies you make for protection, suddenly turning into assassins, targeting and destroying your own healthy cells. It sounds like something out of science fiction, but it's not. It's the reality of a condition we call Type II Hypersensitivity. And it's a fascinating and sometimes pretty devastating case of mistaken identity happening inside our own bodies.
So, what are we actually dealing with here? The official name, like we said, is Type II Hypersensitivity. The most important thing to remember is that it's antibody mediated, and the main culprits are two very specific types of antibodies, IgG and IgY. In this condition, they basically go rogue. They start identifying normal antigens on our own cell surfaces as foreign threats, and the moment they bind to one of our cells, they've marked it for destruction or, at the very least, some serious dysfunction. Okay, so to really get how this happens, we need to look at the attack plan. This isn't some random, chaotic assault. It's a direct and targeted mission where the antibody acts as both the homing missile and the trigger. Let's break down the basic sequence of events.
It all starts pretty simply. First, you've got an antigen sitting on a cell surface. For some reason, the immune system messes up and creates IgG or IgM antibodies against it. Now, this can happen because the body just loses its ability to recognize itself, or because of something called molecular mimicry, where a foreign invader looks so much like our own cells that the immune system gets confused. These new antibodies then find their target and latch right onto the cell, and that binding, that's the critical moment. It's the signal that unleashes the immune system's full destructive power. So once that antibody is locked on target, the immune system doesn't just have one way to take it out. Oh no, it has three distinct and highly effective methods of destruction. You can think of it like deploying one of three different special ops teams to get the job done. Let's take a look at their strategies.
All right, here are the three major attack strategies. First up, complement lysis. The antibody kicks off this domino effect with a bunch of proteins we call the complement system. They assemble into this weapon called the Membrane Attack Complex, or MAC, which literally drills holes into the cell membrane, making it burst. You see this happen in autoimmune hemolytic anemia. The second method is opsonization. Here, the antibody basically acts like a bright, flashing eat me sign. Immune cleanup cells, called phagocytes, see these signs, gobble up the tagged cell, and digest it. And finally, we have ADCC. That's short for antibody-dependent cell-mediated cytotoxicity. In this scenario, the antibody tag calls in a specialist, the natural killer cell, which shows up and delivers a lethal injection of toxins to execute the target directly. But here's where the story takes a fascinating twist. Destruction isn't the only possible outcome. Sometimes, these antibodies don't kill the cell at all. Instead, they act like hijackers, seizing control of the cell's communication systems and just making it misbehave, either by shutting it down completely or by kicking it into overdrive. And this slide perfectly illustrates the two sides of that hijacking coin. On one hand, you have Myasthenia Gravis. Here, antibodies bind to and block the acetylcholine receptors on muscle cells. This stops nerve signals from getting through, and the result is pretty severe muscle weakness. But then, in Graves' disease, the total opposite happens. Antibodies bind to the TSH receptors on the thyroid gland and stimulate them nonstop. This makes the gland produce way too much thyroid hormone. So you see, the same basic mechanism, an antibody binding to a receptor, can cause two completely different diseases, all depending on whether it blocks or activates its target. Okay, now that we've got the mechanisms down, let's quickly flip through the case files. A quick rundown of the key clinical conditions caused by Type II hypersensitivity. These are the classic examples you're going to see again and again. This table gives us a great at-a-glance summary. We've already talked about autoimmune hemolytic anemia, where red blood cells are destroyed. Then there's hemolytic disease of the newborn, where a mother's antibodies actually cross the placenta and attack the baby's red blood cells. In Goodpasture Syndrome, antibodies go after the kidneys and lungs. And of course, we just covered Myasthenia Gravis and Graves' disease, the textbook examples of receptor interference. So when you really step back and look at the whole picture, it becomes crystal clear. The very same system that's so perfectly designed to protect us can, through a simple case of mistaken identity, become a pretty powerful perpetrator of disease. It really is the perfect definition of a biological double-edged sword.
Understanding all these pathways of destruction and dysfunction isn't just an academic exercise. It's the first critical step toward actually doing something about it. So the question I want to leave you with is this. Now that we know these antibodies are the triggers, how could we design therapies to intercept them, to disarm them, or to protect the cells they're targeting? How do we stop the friendly fire without having to shut down our entire defense system? That's the real challenge for modern medicine.